Next, we're going to hear from Congressman Dennis Kucinich. Thank you.
Good afternoon. Good afternoon. It's wonderful to be here with you. And as I'm listening to this discussion today, it reminds me that you are the ones who have to insist that America reconnect with its greatness and its goodness. Yesterday in the House of Representatives, Americans were told that we can't have peace. We have to keep a war going for another year or two in order to have peace. I voted against that because I believe that we have to take a new direction which says if you want peace, you vote for peace, and you have a plan for peace. We're being told, in this state and other places, that you can't have kindergarten care or universal pre-kindergarten care. And yet when you accept that, then you don't get it. Efforts are made to just cut short a movement. Today, at this forum, the sub-message is that you can't break the hold that the insurance companies have. Not a single candidate up here has challenged the underlying problem with our healthcare system, and that is insurance companies are holding our healthcare system hostage and forcing millions of Americans into poverty with unconscionable premiums, co-pays, deductibles. So I ask you, is it consonant with America's greatness that candidates step away from the one solution that could change it all? A not-for-profit healthcare system is not only possible, but H.R. 676, a bill that I've introduced in a number of Congresses, the Conyers-Kucinich bill, actually establishes Medicare for all, a single-payer system, and it's a not-for-profit system. It's time we ended this thought that health care is a privilege, it is a basic right, and it's time we ended the control that insurance companies have not only over health care, but over our political system. Think for a moment if Lincoln had decided, well, you know, there's just too much resistance to this idea of emancipation. Think if the suffragettes had decided, well, you know, we can't take on these men who are determined not to include women in the political process. What if Martin Luther King had said, you know, we can only push so far for civil rights? Or if Cesar Chavez had said, well, you know, no puede. What if? What if we buy into this logic that says that can't have peace? We're being told here today to buy into a view of the world which says that, well, you know, we'll have the insurance companies run the system, we'll have people, you know, we'll work out competition between the insurance companies, and maybe we'll have government subsidize the insurance companies. Where's our call for greatness? What if FDR had said, well, you know, we can't really do the New Deal? I'm talking about a real deal for the American people. A universal, single-payer, not-for-profit, Medicare for all, and it's good to be here with you to talk about it. It's already in legislative form. 62 members of Congress have signed on to the bill. Over 14,000 physicians have signed on to the bill. The people of California voted for a plan just like it. The Senate of New Hampshire endorsed it the other day. The legislature in Kansas put their name on it and endorsed the idea. We can do this. Si se puede. Yes, we can. Break the hold of the insurance companies on our health care system and lift the American people out of poverty. That's what my presidency is going to be about. Thank you. Thank you. Thank you. So let's talk.
Sure.
Let's have a conversation.
Well, Congressman, you are the first advocate we've heard today of a single-payer health care system, essentially Medicare for everybody. However, the last time, my understanding is that it was on the ballot was in Oregon, which is, you know, if not, except for Vermont, probably, you know, the most liberal state in the country on these issues, and it didn't pass. Where do you find the political will for a single-payer system?
I traveled this country in the last election, came to an understanding that health care is the one issue that unites everyone. Where does the support come for a not-for-profit health care system? It comes from all over the country, but it's waiting for a candidate for president who will lead the way, and I've already done that. The Conyers-Kucinich bill, H.R. 676, is the vehicle. Now, how can you break the hold that insurance companies have? Because let's face it, in Oregon, they pumped millions of dollars into do everything they could to try to defeat the initiative. This is really simple. You need a president who doesn't have strings attached, someone who is ready to confront these insurance industries, someone who isn't owned by the interests. Look, right now in Wall Street, these hedge funds are coming together, pouring millions into campaigns of candidates for president. We're looking at a system that people are telling you the words you want to hear, but when you're looking for specifics in a plan, they're not developing it. Why can I do it and other candidates can't? Because simply, I don't have any strings attached. I've been in politics 40 years. I've been a councilman, a clerk of courts, a mayor, a state senator, and a 6-term U.S. congressman. I'm known for having integrity and a willingness to take a stand and for changing the outcome when others say it can't be done. This is the moment that I call upon you in the SEIU and the American people to say, let's join this movement that already exists, call upon the power of our hearts and our intellects. What are the animating forces? How's this? Half of the bankruptcies in America right now are directly connected to people not being able to pay their hospital bills. And of that amount, 75% of the people are working, have jobs. People's whole lives are on the line here. So the question is, will the American people be given a real choice in this election? You know, this isn't American Idol here. I mean, really, you know? I mean, I could come up here and, you know, and do a little dance about, well, you know, we're going to take on those insurance companies. Oh, really? Are you going to take away their profits? Are you going to remove the fact that, you know what, 31% of the money that's in the system right now, of $2.2 trillion a year, goes for the activities of the for-profit system. If we take that money away from the insurance companies and use it for the American people, well, guess what? We have enough money for vision care, dental care, mental health, prescription drugs, and long-term care. I'm going to call on the American people to stand up for their right. Health care as a right, not as a privilege.